Familia, this is a special day. We're celebrating all together something that is very tight and very near my heart, community clinics. AltaMed and other amazing community clinics have been there for more than 6 decades. If I give you a number, and I'm going to pause for a couple of seconds, how many people do you think that we serve in the entire US? It's about 30 million people that actually are going to our community clinics all over the country. Basic healthcare, from primary care, internal medicine, OBGYN, pediatrics, and other amazing services like mental health, promotores and promotoras de salud, community health workers, all together working for one community. That's why it's so important right now to celebrate this amazing day. Part of this is to make sure that we are partnering up. All together, we can actually serve more people, have a greater impact, and sometimes in our clinics is the beginning from that road to create an amazing, healthy community. Because of that, we have 3 amazing organizations that are joining today. We are celebrating community clinics and, of course, our partners, because our partners in good, like the California Primary Care Association, like the Coalition of OC, and the Community Clinic Association of Los Angeles have been making sure that our communities and our families, no matter where we're coming from, are taken care of. Today, I have the honor and appreciation to bring someone that I really have met probably in the past 2 years and has been leading the way from the community, the CPCA Association. And he is my amazing friend, Ayo Taylor. Ayo, welcome. How are you?
Dr. Shapiro, I am doing well. How are you, my friend? Good to see you as always.
Doing great and very excited for this amazing week because it's time to celebrate. We have been through a lot and celebrating our clinics, the work that we do. It's impressive. Tell me, what do you do? What's CPCA?
Dr. Shapiro, my name is Ayo Taylor, as you said before. I am the Assistant Director of Media Relations and Strategic Communications for CPCA. CPCA is the acronym for California Primary Care Association. CPCA represents close to 1,300 community health centers and some of our regional associations across the state of California, helping our health centers meet their mission of providing equitable health care throughout the state of California.
That's amazing. And I do have a question for you. As part of the things that we do is, first of all, what is the National Healthcare Center Week?
Well, before I answer that question, happy National Health Center Week to you and to all your colleagues at AltaMed for all the incredible work that you all do to serve your community. So thank you. National Health Center Week is an opportunity to celebrate and increase awareness for our health centers really across the country. And it's an occasion to highlight the commitment and passion of community health center staff, your board members, and supporters who make it possible to provide quality, comprehensive healthcare services to the 30 million patients that health centers represent nationally, as you had referenced earlier. For us here in California, that number is over 7.7 million patients across the state. So we celebrate the heroic work done day in and day out by our health centers.
That's amazing. And that's, the way to go. And I'm not going to stop there. Now that I have you here, I have a second question for you.
Yes, sir.
Why is it important for community health centers to celebrate and observe Civic Health Month? Is there any relationship there?
No, absolutely. And Dr. Shapiro, this is a subject that's near and dear to my heart because of the history of health centers and it being part of the civil rights movement. Many people have fought and died for the right to vote. This right should not be taken lightly. And in fact, 80% of health outcomes are determined by non-medical factors, such as access to food and affordable housing. So it's important that we get low propensity voting communities out to vote. Studies show that people from communities that go out and vote have better health outcomes. So it's important to get people from low propensity voting communities into the voting system so we could have better access to care and have healthier communities.
Then now I know a lot of more things. We need to make sure that we are there and we are represented, and especially celebrating this week of partnerships. I send a huge hug to the entire team in CPCA. You have been an amazing partner. Sometimes our patients do not know all the amazing things that you do there to make sure that we have the resources and, most importantly, the tools to take care of our community. Then Ayo, thank you so much, and I'm sure that I'm going to see you soon, somewhere, maybe in LA.
Look forward to seeing you in LA, Dr. Shapiro. Take care.
Thank you so much. Moving forward right now with a lot of the things that we're doing is making sure that we're partnering from the state level to local levels that we're taking care of. Our communities live in a very diverse way. And right now, between the places that we take care of here in AltaMed, that is practically LA County and Orange County, there's a special place in my heart for an amazing organization. And I'm going to put here, and I'm going to invite Joan Priest, Director of Government and External Affairs for the Community Clinic Association of Los Angeles, to be with us. Mi queridísima Joan, how are you?
Hi, Dr. Shapiro. I'm great. How are you?
Very excited because I know that you have been working a lot, and our CEO and President McCarthy has done amazing things for the past years, and we're coming back from that thing called COVID. And I know that we're moving forward with a lot of things. And tell me more about your organization.
Yeah, the Community Clinic Association here in Los Angeles County, we're the largest, what we call a regional association of community health centers in the state of California. So you just met Ayo from CPCA, and we are a CPCA member. So we work super closely with Ayo and the whole team up at CPCA on National Health Center Week, and so many, like you mentioned, other things as well. But CCA LAC, we are based right here in Los Angeles County. We have 66 member organizations. That's 66 health center organizations. They operate something like well over 400 sites if we start including mobiles and intermittent sites and all that good stuff. So there's a lot of health centers here in the county of Los Angeles serving almost 1.9 million patients.
That's not a small number. There's countries that do not have that amount of people. That's just amazing. And I do have a question for you. Are you ready?
I think so.
Okay, let's see here. How do clinics associations like yours support the community health clinics during the National Healthcare Center Week?
Well, I said CPCA is a part of that. We work really closely with CPCA. I will say we've been comparing notes on who's hosting what events all over LA, and I know some of their staff are here in LA this week. We spend a lot of time encouraging our members to plan their events, tell us about their events. We work closely with our members around inviting elected officials out to their events. So National Health Center Week is such a fabulous time to, I think of it as showing off health centers. So really getting those elected officials and their staff out to the health center sites, seeing health centers, meeting the staff, and really getting a feel for health centers and what they're doing in the community. So we spend a lot of time, working with our members to get elected officials out, posting on social media. We've got a list of events on our website. And then our team runs around town all week long. So you mentioned our CEO, and I think she's in one part of the county today. And we've got team members in other parts of the county, really trying to go to as many events as we possibly can.
That's amazing. It's a moment to celebrate because, the community health centers were born with the struggle of social justice because we understand that health, it's not something that it's just something nice to have. It's the basic part of our lives. If we are not healthy, and I can tell you for sure as a parent and also as a pediatrician, if I'm not healthy, I cannot take care of my family. and my patients and my community and my parents, and it starts growing around. And that's why it's so important what you're saying, and the key aspect of what we do every day. Then thank you for that. And I have a second question for you. What are some roadblocks that community health centers are having right now with civically engaging their patient population? Because that's some of the key aspects of the things that we have, as community clinics.
Yeah, it's a good question. I spent a lot of time thinking about this one. And I think, we like to say, if you've seen one health center, you've seen one health center. And health centers, as you know, Dr. Shapiro, are all really, really different. And I suspect that, barriers to civic engagement vary across health centers. I will say patient engagement is so important for health centers, and they do so much around patient engagement. Coming out of COVID, as you mentioned previously, one of the big things we hear is challenges related to bandwidth, and I don't have enough staff to do the things I need to do all day, every day. So I think that right now is probably one of the really big challenges health centers are facing. I don't have enough bodies. I don't have enough workforce to do, A to Z, and then I need to add on, another A to Z. How do I find the staff to really carry out this work on the ground? Because we know they want to, and we know, as we saw during COVID, I think we knew already, but I think newly appreciated is what a valued and trusted resource health centers are in their community. And we saw patients in the community really turning to health centers. And so there's huge opportunity there, I think, with regard to civic engagement in the health center space.
Thank you for that. And please, a huge virtual hug to you. And thank you so much for absolutely everything that you're doing and the community that you're taking care of, because without your leadership and the things that you're creating in our county, it's difficult for us to reach out, to create that partnership and to grow all together. Then everything at the end of the day is who is your close circle and how can you actually help other people to join in. Then thank you, Joan, so much for that. And I will be seeing you hopefully soon. Then
I'm sure. Thank you.
And congratulations. Now, family, we are going to invite someone that is very close to my heart, that we did amazing work in that community, especially with COVID times, where a lot of information and representation in our community was so important. She's someone that has been doing a lot of amazing work. And let me give you a piece of her right now. Her name is Aurora Garcia Barrera. She's the Director of Policy and Government Affairs for OC Coalition. And mi queridísima Aurora, welcome. How are you?
Muy bien, gracias, Dr. Shapiro. How are you?
I'm very excited to be with you here. We have spent a lot of time engaging our community in many topics. And tell me, what's a coalition of OC?
Yeah, thank you. I'll start off by saying I'm the Director of Policy and Government Affairs here at the Coalition of Orange County Community Health Centers. We are a coalition of 26 member health centers, including AltaMed, and together our members have nearly 80 sites across the county and serve approximately 350,000 patients annually.
That's amazing. I have a couple of questions ready for you. Are you ready?
I'm ready.
Well, this is the first question. What's the role? What role does a clinic association play in engaging elected officials on behalf or with the regional clinics?
Yeah, thank you. Great question. So we specifically serve as a liaison between our health centers and our elected officials. We know that some of our health centers, such as AltaMed, have higher capacity for civic engagement and advocacy work. And then we have other health centers that don't really have the staffing capacity to engage in these types of activities. So with that, my support in this area includes setting up things like legislative visits, training our members on policy issues, providing them with talking points on key items, regularly communicating with elected officials on their behalf. We also request certificates of recognition for them. We invite them to attend to events and activities. This week alone for National Health Center Week, we are hosting 6 different health center tours. We invited about 86 legislators on their behalf. So in a nutshell, Our job is really to ensure that our members are up to date on, key policies and the impact that they may have on the health centers, their operations, and their patients. And then we really facilitate their engagement with elected officials.
That's amazing. It's practically the bridge between the voices of our community and making sure that the people that we elected are hearing what are our concerns, our needs, and most importantly, the representation that we need. And thank you so much for that. Then I have a second question for you.
Okay.
And here we go. What would you like to see in the future for clinics to be involved in Civic Health Month and the democratic process?
Yeah, I personally believe, and I know the rest of our team agrees, that we have a lot of room for growth in this area. Earlier this year, we held a virtual session as part of our series that's called Coffee Connections, where we spoke about the importance of advocacy and civic engagement within health centers. Dr. Shapiro, you and others in the AltaMed team were so gracious to join us and share about the amazing work that you're all doing in this space and how you integrate it to your daily activities and into your strategic planning. So as a follow-up to this event, we have been putting together a curriculum on advocacy and civic engagement because, as I mentioned, our members' capacity really varies. And we want to make sure that they're prepared to engage in any way, whether it's providing public comment or whether it's talking to their patients about civic engagement. Another thing that I wanted to point out is that, not just in Orange County, but across the nation, I think Joanne touched on this, is really mobilizing patients in civic engagement. I always think about how in our last election cycle, some elections were really close and some folks even won with less than 3,000 votes. So I always think about it, in Orange County, we have about 350,000 patients. So imagine if we engaged 10% of them or even 5% of them, if we just ensured those folks came out to vote, that could really change the outcome of an election. So there's a lot of work that we need to do there to begin building a patient base.
That's amazing. And thank you really for the work that you do and the representation and creating those conversations, because sometimes we think about health, about like a pill, a vaccine, our sugar levels, but sometimes that part, and Io actually mentioned it, and Joanne actually underlined it, and right now you're actually closing that conversation. It's not just our body, it's the environment, is the, what's the social determinants of health, what's the policies that are there around our communities, because all of them juggle what we do. Then Aurora, big hug again. Thank you so much for joining us. And Familia, one of the things that I really want to make sure is that you understand that you are the most important part of what we do. No matter where we are, no matter what we do, you heard from amazing leaders from CPCA, from the coalition from OC, from the Community Clinics Association of LA County, and from us from AltaMed. We are here because of you. You are the most important partner that we have during absolutely all the process of the past 6 decades that we have been trying hard to improve the way that our communities move. If you're interested on this, we beg you, please check this out. We will be having a voter ER civic engagement conference where a lot of the leaders that you saw today, we're going to be talking about how can we improve our communities. There's a phrase that I loved, and it's very close to my heart, that when you have a table, you can have two choices. You can be the main dish or be part of the dinner. This is the time that all our health and the way that we live and the way that we breathe and the way that we do absolutely everything, it's connected. You saw from the state level to the local counties, and this actually expands to the entire nation of the way that we can move forward our health, our community, and most importantly, the future of our kids. I do want to make sure that, again, there's the link here moving, but from there on. And one of the last things that I want to leave you with is this is a time where we're talking about medical determination here in California. If you have not heard about it, it's very important if you're using medical services to make sure that your address is up to date And that way you can actually take care of yourself, because right now, for the past 3 years, the cycle was automatic. You didn't need to do absolutely anything. But right now they're sending an envelope with information where you need to check and actually send it back in order to have your medical continuation. That way you will be taken care of. And most importantly, you do not want to wait until you're getting your prescription. There's no more insulin because you need to pay cash, or there's an accident, or God forbid, cancer, and you end up in the hospital and they tell you the bad news that you do not have healthcare coverage. That's something that we can do, and something that we can actually move forward. Then make sure that as we say in Spanish, pasa el chisme, make sure that you share it with everybody else. And familia, I'm very proud to finish today with the road to a stronger America. That depends on us. Of the 30 million patients that we are taking care of, from the millions of patients that we take care of them here in California, in our local community clinics, and we are just a mere little drop of everybody that is actually helping here, and we are completely here for you. Then, familia, as every week, I send you a huge hug. This is your Vital Conversations, Conversaciones Vitales. And please send us your questions, your concerns, and we are completely here for you. And as every week, make sure that you're vaccinating yourself against fear with a dose of truth. Nos vemos, familia.